There has been a very high number of new achievements and new things. This is what makes our field so exciting. And some of these new things coming were contact sensing catheters that created a high difference in terms of lesion creation. Also, the new version of the theme mapping system have completely changed the way we approach our procedures. In the old times, we were mostly relying on fluoroscopy, but now we mostly relate in the 3D mapping system and the way that we create lesions, trying to have lesion coalescence one in another. So this has changed completely how we tackle these procedures. In addition, we have now new imaging techniques that can be integrated in the mapping system, and this also is important, in particular for VT ablation. So I think that this is something that is changing and will change also in the future. I think that although we have done many advancements and we have achieved many new things that are helping us, still there are unmet needs in these two particular areas. We have a better knowledge and better understanding of our lesions, and we have a better tagging of our lesions with auto mark or tagging of the lesions. But still, first we need a more stable maps with some of our 3D mapping system in order to have a more accurate tagging of the lesions. In addition, we need a compromise between a deeper lesion, more complete lesion, but at the same time safer lesions. This is one aspect. The other aspect is imaging techniques. There has been great achievement, but still there are some way to go in terms of better defining the substrate and better integration of these imaging techniques with our 3D mapping system in a daily basis, not just for research. I think that it's more or less accepted for atrial fibrillation ablation that you will have a kind of 35 recurrence rate for paroxysmal atrial fibrillation. For persistent, it's a little bit more complex because it depends of the series and the technique followed. But it's obviously less successful than for paroxysmal, so I will expect roughly between 50 to 60. This probably is changing rapidly because we have new tools, new balloons, new catheters with contact sensing and new strategies. So my forecast is that we will have better numbers in the near future. For VT, it's different in terms of clinical VT recurrences, that I think that our success rate presently is roughly between 85–90%. But then you have to deal with non-clinical recurrences, and then this is the problem with patients with severe left ventricular dysfunction. The three main components for a successful complex ablation, I think they rely in first is experience. This is a long journey. Once you get into the field, there are too many things to learn and too many things to be trained. So we have to admit that it's still a long journey. So one is experience, the other is technology. This field has changed dramatically, and without these tools, probably it will be really tough to tackle with such a complex cases. And finally, I think that the important component is to be excited and motivated what we are doing, trying to help patients.